Welcome to The Great Indoors, the podcast series where we discuss the technological and cultural impact that the COVID 19 pandemic has had on our individual lives and on society as a whole. Please subscribe to our podcast. It is available on all good podcast channels: Apple, Google Podcasts, Spotify, SoundCloud, and also visit our website, amdocs.com/the great indoors, where in that site we have some very interesting materials directly connected to the topics that we discuss in each episode. There's even some nice giveaways in there as well that you might want to check out. So today we're at episode 6. And how are you feeling? I mean, how are you feeling? How do you feel now during this pandemic? I'm quite lucky. I just returned from a vacation. I feel pretty good, pretty relaxed, and pretty recharged. But prior to that, I think it's fair to say that all of us have taken some sort of impact, some sort of hit to our mental well being. Some of us don't know it, but it's there. And studies show that there has been a separate pandemic, and that has been the effect to mental health. In fact, it's doubled the amount of instances of mental health issues. And that's what we're going to discuss today, and how technology is performing a crucial role rather, as a coping mechanism, or enabling some of the coping mechanisms that even the World Health Organization suggests in order to alleviate any mental health conditions or stress that you have. So I'd like to welcome today's guest to the Great Indoors, and her name is Dr. Victoria No. Welcome.
Hi, thank you for having me.
Thank you for joining. It's great to have you.
It's great to be here.
Vicky, I can call you Vicky, right?
Yes, of course.
Because when I was first looking at this, I saw Doctor No, and that's of course a James Bond villain from the 1960s. And I'm British originally, so I tend to
Yeah.
talk about things like this. So, just for everybody to understand, Dr. Victoria No, Vicky is an associate professor at the City University of New York Graduate School for Public Health and Health Policy, and director of the CUNY Center for Innovation in Mental Health. Vicky is also a licensed clinical psychologist and adjunct scientist at the RAND Corporation. She specializes in mental health implementation science, quality improvement, and global mental health. She has extensive expertise in developing, evaluating, and building capacity for mental health integration for a variety of health platforms in the United States and abroad. So, wow, I mean that's quite some credentials there, Vicky. And look, it's great to have you on because the purpose of this podcast has been to talk about all the things, all the factors that have occurred during the pandemic, how technology has helped. And of course, I think one of the biggest unfortunate realities of this crisis, along with obviously the COVID 19 itself, is the burden on mental health that has happened because of the pandemic. And I know you've done a lot of research and this is your profession. So just give us an overview. The pandemic has impacted everything globally. We talked about education last week, the social implications, but what kind of mental issues have emerged over the last 5 months now, isn't it? Wow.
Yeah, it's been about 5 months now. Well, this is an unprecedented time, and it's not surprising that this pandemic has an impact on our emotional health, right? We're seeing a rise in mental health problems like anxiety, depression, PTSD. In many ways, we are confronted with a collective trauma we're all going through together. So we're seeing that in terms of the numbers as well. As you might know, we've done a survey study in New York City since the beginning of the pandemic in early March, and we've been surveying New Yorkers, 1,000 New Yorkers each week consecutively for 12 weeks now, and we're going to move to doing it monthly. But we found alarming rates of anxiety and depression risk. About 35 to 45% experience anxiety and depression symptoms nearly half of the time, which usually is indicative of people having clinical levels of depression and anxiety. In another survey that I'm part of, where we're surveying 2,000 students in the CUNY system, and the CUNY system is the largest public university system in the United States, half of all students in New York City are CUNY students. And so 2,000 that were surveyed are also reporting very similar in the citywide study. So these results are pretty consistent. And for those of you who don't know, 35 to 45% represents more than twice the rate that we normally have. So usually community rates range anywhere from 5 to 20%. And so now we're seeing 35 to 45%. There's been other studies and other that conducted from other institutions that are slightly higher, but generally we're getting these rates that range from 35 to 50%, which is huge.
I looked at this a little bit. Now, obviously, there's several factors that contribute to this almost doubling in what you would normally see. Is it because people are suffering anxiety because of the fear to their health because of the pandemic? Or are they feeling the anxiety and the stress through the fact that they're locked indoors and they're not having those social interactions anymore? Has your research shined on any light on the potential, the direct causes of those numbers?
Yeah, we actually were looked at some of the risk factors, and of course, the perceived risk is a factor. People who are, in closer contact to those who may be more likely to be at risk. For example, if you're an essential worker, you're out there, you're having to take the subway, go out and work the grocery stores and deliver and be in contact with people. So that raises the risk level for yourself, but also for your family. And oftentimes, people's concern about their family is probably what impacts them more than even themselves. That's what we're seeing when we ask about what you're worried about. They're worried about impacting and affecting the people around them that they love. And then of course it's also having someone who's sick at home and having to take care of them and wanting to be careful, especially if you have someone who's vulnerable. That is very stressful for folks. Then you've got onslaught of job loss across a lot of cities in the United States and the world. And I think that is another huge stressor for a lot of people, because that can result in being evicted, that can result in you not being able to take care of your children, that can result in a wide variety of, you know, catastrophic impacts. And so it makes sense that that's going to be a really big factor. And we're also seeing things like food insecurity and homelessness risk. So, in our survey in New York City, we're seeing rates around 40, 40%, 35% risk for having food issues, like not being able to get food or not having enough money for food. And of course, all of this is related to job loss and economic insecurity. We're seeing rates ranging from 30 to 40% of people reporting that they have lost their job or someone in their family has lost their job. And so, this combination of the economic factors with the social factors and the health factors has really converged in a very detrimental way for our health, our mental health.
Yeah, I did a little bit of research, as I always do, and did some looking around. And I stumbled across the World Health Organization website. And there's some good stuff on there on, coping with stress during, this whole pandemic. They've got some nice infographics. But I downloaded one of the infographics. Maybe we'll put this on our website. And it says coping with stress during the COVID-19 outbreak. And what caught my eye straight away is that first graphic is a mobile phone, right? And it says, talking to people you trust in your family, please contact your friends and family. That's their first piece of advice is connecting, you know, and obviously we talk about how technology alleviates, some of these things. But do you see that as as a factor in your research in alleviating some of that?
Yeah, I think social connection is really important. Anytime you have a collective trauma, a collective horrific event, the way people cope with that is they connect with one another. But in many ways, what we're confronted with now is a time when connecting is not so safe, or connecting in the way that people are used to connecting in terms of physically being together is not possible, and actually increases your risk. So you've got this public health intervention, basically the social distancing, that that interferes with the mental health needs, right? And so we've got to find other ways of connecting so that people can maintain lower risk, or lower exposure to risk. And so um, I think that it makes a lot of sense to connect over the phone, to get on Zoom, and we're seeing that everything is on Zoom these days, from graduations to proms to dating. Everybody is on Zoom. Birthday parties are on Zoom. So we're getting really creative with technology, and we're learning how to still, mimic some of the things that we get from physical in-person interactions.
And I think it was, what we did when we did the one from, it was the last episode. We looked at education,
Hmm.
and we had three little students on that I know very well, but they talked about how they were coping with doing their distance learning, their home learning. They used Zoom, they used Microsoft Teams, they used all these tools. But then it got me thinking that they're the lucky ones, right? They're the ones that have the internet connection, the hardware to be able to do this, and that's a huge factor in keeping education going. Are you seeing discrepancies for lower, maybe lower income groups that don't have the luxury of the technology and the equipment?
Yeah, we're definitely seeing this because, just like with what we're seeing with COVID, right? People who have lower income, oftentimes Black and Brown communities, are also, you're seeing a hit in terms of infection rates, in terms of death rate. That also translates to them having higher risk for job loss, food insecurity, housing insecurity. With all of that, you're going to have less access to healthcare, to mental health services, as well as to resources for technology, for education. And so what we're seeing now is this convergence of several pandemics happening at the same time. You've got COVID-19 as one pandemic, then we've got mental health as another pandemic, and the third pandemic is social inequality that translates into all kinds of other issues, as well as racism, institutionalized racism. And so we've got all of these things happening at the same time, and I think that is creating this escalation of mental health problems that we're all seeing.
And I'm looking at your research now, and I'm looking at coping strategies, right?
Mhm.
And I see that 21%, is that 21% of respondents have said that their most effective coping strategy is media, entertainment, and the internet.
Yeah, well, we don't know if it's effective. This is just what they're saying they're doing to cope.
Oh, I see. Right.
So, most people are saying that they're engaging, 35% are engaging in some sort of healthy behavior like walking, taking walks, exercising, yoga, meditation, those sorts of things. And then about a third, 27%, are saying that they're reaching out to people, they're calling on the phone, they're on Zoom. That's what's supporting.
Right, that's the 27.1% social support. Got you. Okay, great.
21% are saying that they're relying on social media, they're watching TV, they're using YouTube, they're basically getting connected, either through social interactions, and usually that's like the social media component, or they're just engaging in media and entertainment to let out the steam, basically.
So then 40, it's safe to say 48%, 48.1% of your respondents see those two factors as them they're, as big coping strategies for them. And they're reliant entirely on technology, right? On having the internet connection, on having the smartphones, on having the applications.
Hmm.
That is quite amazing, I think.
Yeah, absolutely. It makes sense, right? I mean, if you think about it, all of us are pivoting that direction. Everybody's having a lot of people are having to work remotely now, and so so much of our interactions are getting switched to a virtual format, and
Yeah.
that means we have to be more reliant on technology.
And you're a doctor and you have patients, right? And you have to
Hmm.
interact
I
with.
have patients that are part of studies that I'm part of that I've led.
Okay. And you've had to, because we did a survey last week out in the US, and we see a huge spike in people using telemedicine,
Mhm.
right? Using the ability to use technology to consult with their doctors. So, have you utilized this technology in your studies and with the people you're interacting with on this?
No, not yet. I work in Vietnam. My more active project right now is in Vietnam, and so they have actually been able to manage COVID quite well because they shut down completely in the early months, and their numbers are lower than 100 at this point. They're starting to see a spike, but it's like less than 10 people, and that's their spike.
Yeah.
So, our trainings are with community health workers and nurses, and we're teaching them how to identify depression and how to provide behavioral support for depression and anxiety as well.
Hmm.
But that is going to more likely be in person because of the same issues that you raised earlier. Most of the people we work with are the poorest of the poor. They're farmers. They're, people who live in villages. They don't have the computer. The providers don't have computers. If anything, they have they might have a phone, but we have not been able to move to that technology yet because it's not feasible.
That's absolutely fascinating. Now, here's something. So we talk about that. There's four areas of mental health: social isolation, anxiety, depression, and hopelessness. Right? That's the way you've categorized.
Hmm.
And has anything come out that surprised you in this whole thing? As far as, and I'll give you an example. And this may be a silly example, but I went on vacation last week. I went way up north in Canada. It was the first time I'd left like been 2 kilometers outside of my house since March, right? So I found it very liberating. I found it it was probably the greatest vacation I've ever had in my life. Uh, but I tell you, and you may have heard this before because I've heard other people talk about this. But prior to that vacation, since March, I was having the craziest dreams imaginable, right? And I know I spoke to some people at work, and they were like, "Yeah, I'm having crazy dreams," and
Hmm.
even some of my family members, "Yeah, we're having crazy dreams," and I don't know what it was. And then I did the vacation. I've come back, and I don't have any more of these dreams right now. Is this? Is this? This you can bill me for these services afterwards, Vicky. But is this something you've seen? Is this another manifestation
You're
of?
going to pay for my vacation.
Yeah, yeah.
It makes sense, right? We're all very anxious, and when we're anxious, we've got a lot on our minds. When you have a lot on your mind and you go to sleep, it manifests itself in all sorts of ways. And dreams are basically your neurons getting activated, and whatever is on your mind is going to get connected to each other. And so it makes sense that you're going to be much more active in your sleep, which is supposed to be the time you rest, right? And so I think it means that we're carrying our stress into our sleep, and we're probably not getting very restful sleep. And there's been a lot of talk about that, about how at this time, these worries are making it very difficult for people to sleep. And when they are sleeping, they're not getting restful sleep.
Yes.
But that vacation, you talked about, is something that I think we all need to find ways to create for ourselves, whether it be an actual physical vacation where you go somewhere else, or finding a way to create that within your home, a space where you're getting disconnected from the things that are stressful for you. And that's one of the reasons why it's also very important to disconnect from technology, actually, because the more attached you are, you're always, especially with the social media, there's just so much information out there and so much news, and you can really get caught up in the day-to-day reactions to all the different traumatic events that are happening around the world. And so I think there is a lot of value in finding ways to contain that, creating some boundaries around that, and I think vacation is one way to do it.
I talked about that infographic from the World Health Organization, but they actually, yeah, they suggest limit worry and agitation by lessening the time you and your family spend watching or listening to media coverage. And I think that was, yeah, I thought that was interesting as well. So it's less media, more family interaction, right? That was the clear takeaway from that.
Yes.
Let's talk about the effect on children in particular. Has your research or studies shown how the mental health of children have potentially suffered here? Because we did the last one, like I said, we did on education. For children not to be with their friends, to not be able to do the things that they love to do. What have you seen in your studies about how this whole thing has manifested itself on children?
Yeah, I haven't studied it directly, but you know, just from knowing what I know about the field, it makes sense. Children are heavily influenced by the adults in their life. And so if the adults are stressed out, the children are going to be stressed out. They're also used to routine. Routine and structure are really important to children, which is much harder to maintain now when parents are having to work at home and juggle working from home and also parenting and educating their children at the same time. And so sometimes it's like touch and go, just figure out whatever way you need to keep them occupied so that you can go back to your computer and get on your Zoom call. And so, I think that certainly would have an impact on children. The other thing is, like you said, they don't have access to their friends and their playtime as much. And so finding ways to create that, in your backyard, at the park, in ways that are safe, I think are important to do. But I think when people are overwhelmed, it's really hard to manage some of that and to keep that in mind and to make sure that you're creating that space for your children and for yourself to take care of yourself because you're getting pulled into all these different directions and you're usually just in survival mode. So it's difficult to manage the emotional needs.
Yeah. And I don't know if you've seen this again, in just in my sort of little bit of research ahead of this. I went onto the World Health Organization, and they have a book you can download to read to children to help them through through their any stress or anxiety they have, and it's an ebook you can download for free, and it's really interesting. It's My Hero Is You: How Kids Can Fight COVID-19, and it's a big dragon. I think I had dreams like that before I went on vacation. Actually, I think that's what this book was based on. But um but yeah, have you seen that? It looks fascinating. I hadn't noticed it till now.
I've seen it. I haven't looked at the actual content in it, but it makes a lot of sense, because the parent is the most important person in a child's life, or whichever adult is with them. They're the ones that really set the stage and the tone for their life. And so we have to remember that we are their heroes.
Yeah. Now, look, let's talk about the future. This is the one word we use too often with this whole situation is, of course, unprecedented. This is unprecedented.
Right.
And, I think on the physical side of the COVID-19, the future looks pretty bleak for people that potentially have had this seriously.
Hmm.
But from a mental health perspective, what are the future implications? Is this something we will be scarred with for you know, or how do you see it playing out for people? Is it just something that goes away and then everybody feels better? What do you think?
I think it really depends on our response, right? I think in many ways, this pandemic has revealed things about our society that we were not as aware of before. In public health, we've been talking about social inequalities. We've been talking about access to health care and mental health care, and how that is variable for different communities, and how economic strain impacts people. And that's something that I don't think was so present for everybody. And now this pandemic has sort of peeled off that top layer, and people are seeing it. They're seeing the widening of disparity in a very real and raw way. And so I think, one thing that can happen is it raises social consciousness, and people recognize the importance of of, of taking care of all needs, all different types of needs, and the intersection of social inequality and health and mental health. I think that's a really important lesson here. Two is, one of the things that we're seeing in the United States in particular is this lack of coordination in the response, and this tension between civil liberties, personal freedom, and collective action, collective good, and collective welfare, right? And I think that what we're seeing now is that countries that are able to coordinate their response effort, they're able to manage the pandemic. Countries that are not able to do that, we see different surges that are rising in different places. And so that's another thing that I hope that this raises awareness around, is that, you know, it's really important that we recognize the importance of collective action and the collective welfare and how that impacts everybody. These boundaries between people are in many ways false boundaries. We are all connected. And the more that we can the more that we can coordinate, and the more that we can recognize when it's important to sacrifice your own personal liberties so that your whole society and your whole community can survive, that will, do well for us. in our future. And I hope that we as a society can use that to coordinate responses in the future, because this will not be the last pandemic that we face. I think thirdly, with that is, if we're able to learn from these lessons, I think there are other conversations that have come from this that are very important. Like, for example, public health and mental health. Public health, it was something that people didn't really understand. They heard the word, but they don't really know what it is.
Yeah, what is it? What is public health versus mental health?
So public health is just this a field that responds to health from a public and collective orientation, that we recognize that our health are connected. And to respond to individual health needs, you actually have to coordinate it at a higher level, at a system level, at a policy level, that there are social structures that are in place, or structural forces that impact people's health, which is what we're seeing with COVID, right? And so, we as a field think about health from that context, from that larger context, and our
Yeah.
solutions are system system wide solutions. And mental health is also another topic that I feel has gotten more more media coverage in recent months as well. And so it's great because now people are much more aware of the things that they can do to take care of their health and their mental health. More and more people are beginning to recognize little behaviors that they can engage in for self care. Just like things like maintaining structure, creating this boundary between the forces that are stressful for you, and doing things that are helpful in terms of creating pleasure in your life, or creating a space to feel calm and relaxed, right? And so people are beginning to incorporate more and more of that, and they're recognizing the mind body connection. So I think that those are all good things that are coming from this pandemic. And lastly, there's a concept called post traumatic growth, and so that speaks to resiliency. It speaks to growing from something, and learning from this, and recognizing that you can overcome, and that and because you overcome, you've learned skills that can help you overcome other challenges in your future. And so I think that those are learning opportunities for us, and there are ways for us to promote that with our children, with our communities. And I think there's a lot that can be gained from this experience, as horrific as it is. It has raised a lot of important issues, and I hope that it has created an opportunity for people to come together to do something for the collective good.
Well, I think, and it's a common theme, right, in all the topics we've discussed in this podcast series, whether we looked at diversity or whether we looked at education, and now we're looking at mental health. It's really shined a light on these issues, right? It's really put them under the microscope. And
Hmm.
some of the things we take for granted, we won't take for granted again. And some of the things that have helped alleviate the societal, the health, the public health, the mental health issues, we can learn from and put into place for future. And coming at this from the technology angle, and you talk about, this also shines a huge light on income equality, on the disparities in society. Do you think that one of the positives that will come out of this whole thing, whenever it's over, will be policy from respective governments around the world that, and I'll talk about this from a technology perspective, that address those gaps in technology to allow those less privileged groups to have, in whichever form, access to the technology that will enable them to either A, overcome another pandemic, B, lead better, healthier, happier lives. Do you think that's something that can come into place?
Yeah, I mean, that would be great, right? If we could make that part of our policies, to make access to technology, just like access to education, access to healthcare, more available. If technology is the means to education and healthcare, then people need to have that in order to have the healthcare and the education, right? So I think that makes a lot of sense, and hopefully, that will happen. I don't know where we will find the resources for that, but I think that's a very important piece of that.
Well, that's great. Now, listen. So we're going to put your survey on our website so people can take a look at it. What advice because we're coming to the end of the podcast now, but what advice would you give to the community at large? What would you say to people to help each other right now? Things are loosening up a little bit. They are here in Canada. I know they are there down in New York, right? It feels like we're over the worst, but it could all come back as quickly as it arrived, of course. What advice would you give to anybody in the community now just to look out for others? Or what would be the one key advice you would give?
I think the most important thing is to stay connected, find ways to connect in creative ways with your family, your friends, your colleagues. And in many ways, what we're needing to do now is return to the basics, right? We're turning to basic things like, being with your family, engaging in hobbies, finding ways to introduce small pleasures into your life, little moments of hope, little moments of control, little moments of peace. And, you know, doing that without having to engage in like big grand gestures or big activities like go on vacation or have a party. How do you have a party in a different kind of way? How do you celebrate in a different kind of way? So I think like all of that is what we need to do in order to overcome what we have ahead of us.
Awesome. Great. Well, look, Vicky, it's been a pleasure having you on the Great Indoors today. Thank you very much for
Thank
joining.
you. Thank you so
And
much for
I
having me.
hope I hope you're going to have a nice weekend.
Thank you.
There's a heat wave there in New York, right?
Yeah, it seems like there's been a heat wave, but I look forward to that vacation that I'm going to take with.
Yeah, exactly, exactly. It helps. It helps. I'm telling you, no more crazy dreams. And but honestly, it did. It was amazing. Just being locked, being stuck indoors for 5 months, and then just going somewhere outdoors for a week, and I'm real outdoors.
Yeah,
I think the next podcast series will be the Great Outdoors, and I'm just going to record it from that vacation cottage. I think I think that'll be good. I don't know if my employers will let me, but we shall see. We can always try. We can always try. So thank you very much. Thanks again, Victoria. And look, everything we just discussed, we will upload to our website, amdocs.com/the great indoors. Please subscribe to our podcast moving forward. We're available on SoundCloud, Apple, Google, Spotify, all the good podcast channels. And look, we look forward to speaking to you very soon. Thank you very much, Vicky.
thank you. Have a great weekend.